The HR Happy Hour Network is sponsored by WorkHuman. Employees recognized for milestones are 3 times more likely to believe their company actually cares about them. 3 times. So why are companies so bad at it? The stale bagels, the branded swag, the audacity. WorkHuman believes milestones deserve their moment. The space for the people who know you best, your actual work circle, to reflect on your journey, your wins, your impact. The inside jokes, the big moments, all of it. It's called Service Milestones. AI finds the right people, automation handles the rest, and employees choose their own reward from millions of options curated just for them. Milestone like you mean it with WorkHuman, a proud supporter of the HR Happy Hour Network. Find out more at workhuman.com. And thanks for joining us. Welcome back to the At Work in America show. My name's Steve Boese. I'm with Trish Steed. Trish, here we are again. Welcome. How are you?
I'm fantastic. Yes, I love it. We're recording more than ever, so this has been fun. I'm ready for today.
It's been a busy few weeks, and I'm excited for today's show. It's a great topic. We care more, I think, in our firm about well-being and health, mental health, physical health, financial health, all of it. I think we care more than most, right? We talk about it a lot. But today's topic, women's health specifically, is one where we've spent some time on in the last couple of years. And I'm so excited to spend more time on it today with our guest who's with us now, Susan Thomas. She's the Chief Commercial Officer of Lucy RX. Susan, welcome to the show. How are you?
Thank you so much. I'm great today. I'm really excited to be here.
Yeah,
So,
thanks for joining us. Man, this is a great subject. I'm so intrigued and enthused about your passion for the subject as well as what you guys are doing at Lucy RX. But before we dive in to some of the issues around women's health and how organizations can stand up and step up a little bit more, let's learn a little bit more about you and then Lucy RX. So tell us a little bit about that.
sure. Well, I'll start with a shameless plug about my own background. I'm a registered nurse by training. Really focused in the first part of my career in oncology, but kind of evolved into the PBM space about 2 decades ago. So now I lead sales and account management and clinical strategy for Lucy RX, which is a newcomer to the PBM space. And we're trying to do something quite different for the next generation, and that is focusing on patient outcomes and care, not just a white bag at the pharmacy counter, but really improving the health of people, countrywide.
Mm-hmm.
Yeah, we're so excited that you're here to talk about some of the issues and how not just individuals, who might be listening to the show, but how we can impact our organizations and how they're supporting women and women's health in the workplace. One of the shows we've done in the past really talked about the fact that women um, go into things like perimenopause, for example, even as early as their mid 30s, right? And these differences and hormonal changes and some of the other things go all the way into your 60s, and that's really the biggest chunk of your women in the workforce for the most part, right? So it's always been a little bit surprising that we don't have more care in place specifically for women who are going through these different changes in their life and having support to match that. So maybe talk a little bit specifically about how Lucy RX is offering that as an option, because the benefit, it's not just a niche benefit, right? This is something that impacts your entire workforce performance. How do you all think about that there?
Yeah, I mean, well, when this really came to the forefront for me and for Lucy was when a woman came into my office and told me this is not a woman on our plan, but a family member said her clinician had prescribed her hormone therapy for her perimenopausal symptoms, but her formulary was excluding
Um,
the hormone replacement product. And I scratched my head thinking, these aren't, that expensive. Why would they be excluded? Why would women have to jump through hoops to get hormone replacement therapy? And I still don't have an answer to that, but I was determined that we were going to do something different and remove the friction for women that are
Mm.
trying to solve the symptoms that they have, that are clearly underdiagnosed most times. So
Mhm.
we started out initially making sure that the formulary was robust enough to make sure women could get the medications they needed, but we wanted to take women's health to another level by setting up a what we call care guides, a concierge type service to help women navigate these symptoms, because many physicians frankly aren't trained in menopause and perimenopause, and so sometimes the symptoms are dismissed as with maybe a sleep aid or an anti-anxiety aid, when all of it could be hormonal or metabolic. So we fixed the formulary. We added a set of nurses that are trained in these metabolic changes that can help women with simple things like know what to ask your doctor.
Mm.
Mm.
We can mine the data to see women in that age range from 45 to 65 who aren't on HRT, that maybe just need some information about it. We're not prescribers, so we're not going to make sure the woman gets on a drug, but we can give them information on it and help them understand how to approach it with their prescriber. And then finally, the whole GLP-1 conversation,
Mm.
because this is
Mhm.
something everyone's talking about. We've created a new independent pathway for employers to think about GLP-1 coverage for the highest risk population in their cohort. So we know GLP-1s are indicated for type 2 diabetes, and we know there are some indications for cardiovascular health and obesity, but there's a gap there in the middle, mostly representing women in midlife who start to gain weight as a result of the lower estrogen levels
Mhm.
and now increase their cardiovascular risk. So we've created a pathway to allow plan sponsors to add GLP-1 coverage for those women in high risk, uh, that keeps it affordable and allows for access to close that gap in care. So that's in a nutshell what we've implemented around women's health, and it's iterating. We're continuing to see how can we touch or reach more women in this population and help guide them through the next 20 years, because as you said, Trish, the women in this cohort are
Mhm.
at their peak of their careers
Yes.
typically,
Mhm.
and their symptoms are also potentially at the peak. And so they impact their ability to lead teams. They may impact their ability to be promoted. There are studies that say um, that they report the symptoms impact their ability to come to work in
Mhm.
some cases, and lost productivity is real. And if you're in a kind of a career stepping um, phase, you want to make sure that your health is at its best so that you can deliver what your workforce and your work is asking of you.
Yeah, and Susan, one of the other things we've highlighted here on the show, and some other things we've done is often in these same years, many women still have children at home, perhaps, and start running into elder care issues and caregiving issues at the same time.
Mhm.
So all of these things and trying to manage a career and trying to manage, right, as you said, often in the peak of your career and in your most stressful position and most responsibility type position, and focus with leading teams at work and leading everybody at home, right, like most women do, and then while taking care of everybody at the same time while not
Yeah.
feeling great maybe yourself because you're navigating some issues here. It's a lot, right? And so I think
Sure.
employers have never really acknowledged this to the level at which it's required, right? And I think we're starting to see a change, but it takes some effort, I think, as well.
Well, it does. And I think it just takes some creativity and maybe some very simple actions that employers can take that aren't necessarily super costly, but check the box
Yeah.
in attending to those multiple competing priorities. It could be as simple as flex time in order to be able to go get your lab work, to get your blood pressure
Yeah.
checked. to pick up prescriptions for your elderly parents, or take care of your kids, because brain fog is real. Symptoms are real. They slow women down during this phase in many cases, and just allowing flexible time. And
Mm.
then the education, making sure women are supported with education and how to manage their symptoms. Because, I mean, frankly, because it's been a gap for so long, it's concerning as a nurse that women still just don't know that what they're feeling could be normal, but could be treatable.
Yeah.
Yeah. Susan, I think you hit on so many important things that I relate to. I think often, I'll just use myself. When I was in my 30s, I was in a very high stress position. I loved it. Moving up in my career, all those things. I wasn't sleeping more than 3 hours a night, for example.
Mhm.
I talked to my doctor. It was a standalone symptom, right? And then I had brain fog in my early 40s, and that was a standalone symptom. And then I had vertigo in my mid to late 40s, and that was a standalone symptom. And it wasn't until another woman who's just barely older than me said, I think this might all be related, that it clicked. So to me, when you're talking about care guides being available to even help a woman connect those dots, I mean, I was a leader of HR. I didn't know it. So I think you're right. Education is so important here, and normalizing talking about it at work, because it's often through word of mouth. You mentioned that doctors aren't really trained in menopause care or perimenopause care. I
Right.
think my doctor, when I finally talked to her, it was like 6 hours is all of the training she had in menopause care. And, it's so I don't want anyone to feel like, you're going through some symptoms. It might be perimenopause, it might be menopause. Um, you're afraid to ask, because I went and asked my mother, and she said, "I don't think I went through that. I don't think I." So that's why we're not educated, right? The generation maybe before us, they didn't know either.
Yeah.
What are you seeing when you're talking to, whether it be your customers or your care providers, your care guides? Are they hearing these same kind of stories, like that there's a disconnect between even linking symptoms together, or
Oh,
what are
for
they
sure.
hearing?
Well, because they don't all bundle together. They don't all come at one time. As you
Right.
mentioned, from perimenopause to postmenopause,
Yeah.
there can be 10 or 20 years of
Mhm.
symptoms coming and going. And
Mm.
you mentioned you were in a stressful position in your 30s. And so you may have attributed the insomnia to the stress,
Mhm.
when in
Completely.
fact it could be hormonal. And I think um, women just need to be able to ask, "Can we check my hormones?
Mhm.
Let's do blood work to make sure that this isn't metabolic. Maybe it is stress related,
Yeah.
um, but and then meditation may help. But you have to push for and advocate for yourself, so women do, so that you can determine, are you in a metabolic change right
Mhm.
now that can be treated. And the really key part about catching this, or starting to intervene early, is that cardiovascular risk that can continue to rise into our 60s and 70s, and osteoporosis. So, both of them very preventable if we know about what's happening early on. If we start to track waist measurements, if we start to track weight as women are going through, because you don't put on 10 pounds at once. It happens over a course of a decade,
Yeah.
where all of a sudden you're like, I'm 20 pounds heavier than it was in college.
Here. Yeah.
And now your
Yeah.
your risk is higher, and you start to have symptoms. So now we start treating these more um, problematic symptoms than hormone replacement early.
Mhm.
And I
Right.
think that the stigma of hormone replacement, from decades ago, also contributed to just women not automatically getting prescribed one when symptoms were suspect. And I think that's going to change because
Mhm.
of the CDC, and changing its stance on hormone replacement therapy. But there's there's just education that needs to happen. And the more we can do, which is why I'm so excited about having this conversation today, is the more we do this, the more light bulbs go on with HR benefit leaders and prescribers and nurses and women themselves to advocate for themselves.
Susan, I'd love to get into just a little bit of the process that you guys, when you work with corporate clients or health plans, or even individual members, just tell me the nuts and bolts of this. Like, we know what PAMs are, right? We know who our health plan coverage provider is. We know, I just love to see like how you guys actually work in the process with your clients and the folks that you support to actually, help them with these issues and like you said, make sure the appropriate treatments are in the formulary, make sure people have access to. Are you working directly with the clients? Are you working through health plans? Is it both? I'm
It's
curious on that.
yeah, it's both. It's self-funded employers and health plans.
Okay.
The formulary is a no-brainer. It's we've automatically updated the drug lists. It's really not costly to plans to add hormone replacement therapy as a general rule. And that just happens. If
Okay.
you chose to opt out of updating the formulary and adding these hormone treatments, okay, I don't think we've had any clients that have
Yeah.
said,
No
"We
one
don't
would
want
probably
that."
do that, right?
That's the easy part.
Right.
The care guides piece is a clinical strategy and upsell program that we offer to clients. There's a return on that investment. The employers pay a fee to engage our nurses with their population.
Right.
And then we guarantee a return on that, whether it's through adherence on their medications, a reduction in cardiovascular risk by reducing A1C, improving their diabetes trend, getting patients' cholesterols under control. And so we do a number of measures to show our ROI by how the nurse engages with the member and the prescriber, because we don't just stop with engagement with the member. We will reach out to prescribers to make sure that they have a full picture on the feedback that we might have received from a member.
There could be some
And that's
indirect
simple as that.
ROI too, right, Susan, in terms of, hey, employees really like this and, they'll be more engaged. They hopefully won't get as sick or as often as sick, but certainly just, hey,
For
I'm
sure.
going to stick around because my employer is invested in me and part of that investment is my health, right? I got to believe
For
that's
sure.
part of it.
For sure. For
Mhm.
sure. I mean, the employer can certainly measure employee engagement as a satisfaction metric. We also measure member satisfaction and
Okay.
can report on that as well. And then we would encourage employers to measure productivity too, because um, they'll see improvements there as we help women improve their health.
Mhm.
Yeah. I think one thing that I would have liked to have known, because I was the person who was responsible for the benefit plans when I was still in that HR leader position, is I almost feel like we sometimes reward not just women, but all employees if they are working through the night, right? You see those emails coming in. And I feel like I didn't see that as like maybe a red flag, like, oh, this could be a woman who might need information about care. So I would love to hear, like, are you getting those kinds of questions? Are they that granular yet? Or are people just trying to wrap their heads around like, oh wow, we need to be thinking about this through the lifetime of the employee with us? Because I feel like it was such a big miss that planning out benefit opportunities that we weren't including this.
Yeah.
So
Yeah. It's a great insight and question. I don't know that we're seeing that granular of a question come through, but we're not waiting for folks to raise their hand and say, I think I have a problem. We're
good.
very deliberate on mining the data of our population. And I think that's what we're asking plans to do, employers to do, is work with your PBM or your health insurer to mine the data of the women in the population.
Mhm.
How many are in this age group not on a hormone replacement. Doesn't mean they need to be or must be, but if they're having symptoms, maybe they're on a sleep aid and an anti-anxiety agent or an
Yeah.
antipsychotic, but no HRT. Could we be treating the wrong symptoms? Possibly. That's worth a conversation with the prescriber. Or are they a type 2 diabetic? Should we be monitoring their weight more frequently and making
Mhm.
sure that they're not continuing over the course of a decade to gain that belly fat weight that puts them at higher cardiovascular risk? And so that's the approach we've taken, is mine the data, know the population for the employers so they can make educated decisions around support for that population. And that might be expanding coverage, pharmacy coverage. It could be adding care management, whether it's us, as the care guide, or adding a women's health component like MIDI, or
Mhm.
there are many point solutions out there that
Mhm.
can help employers to offer more support for the members. But if you don't know what your population looks like, you don't
Yeah.
know where to start. And so that's our approach, is help the employer understand the
I like
population.
that starting point because I think that if you're not doing numerous things, right, to make people feel cared for and that valued, this is such a personal thing. It would really make me feel valued. Like even working with Steve, we may be a smaller company, but knowing that he values women's health helps me do a better job. And it also helps when your employees need to say, okay, I've got something going on, right?
Yeah.
They don't feel like there's gonna be punishment for it. In fact, they feel like they're gonna have that extra support that they might not be getting from home. So, I feel like it's a win-win
Yeah.
if you're using Lucy RX as part of that program to offer your employees. Does it also cover the, say, spouses or partners of the male employees, or is this just more targeted toward female employees in the organization?
No, that's a fantastic question, because I have had so many conversations with spouses of women going through metabolic changes and
Mhm.
just feeling at a loss for how to help.
Yep.
And I don't have any studies, but I guess that marital strife
Mhm.
escalates during this time,
Yep.
and so being able to, our nurses can help guide that as well, and help get partners or families into counseling if that's an appropriate next step, or just awareness of, this is a normal symptom of this period,
Yeah.
here's how to support it, here's what to help with, asking the doctor, here are the medications that might be helpful, here's the symptom control, keep the temperature down in the house, don't turn the heat up. So absolutely, it's not restricted to, you must be a female to use our nurses. It is a women's health, and that's supporting them through the whole
Yeah,
ecosystem.
Susan, I think that's an
Perfect.
excellent point, and because I do think, Trish, you said, "Oh, it's good to work with Steve because Steve cares about this stuff." Look, I've always cared about it because I think
Mhm.
I'm just a normal person. I'm not, a psychopath. But I will say this: before we started talking about these issues a couple years ago, we had Mitty on the show a couple years ago, and
Mhm.
before we had Joanna came on the show, I didn't know anything, anything. I knew nothing. Menopause to me equaled hot flashes. That's just a story I'd
Okay.
heard, right? As
Yeah.
just a man growing up in this country. And look, I'm not trying to make a joke of this. What I think, this probably still happens a lot, and I do think that there's a lot of folks who are making decisions in organizations who are guys just like me, maybe a little younger than me, maybe a little older, whatever, right? But equally uninformed, or
Mhm.
partly informed, or anecdotally informed, and not really super well informed. Because yeah, we're a small company, and I got confronted with it, because folks in our company we're going through things, and then we talk about it on our show. But I could see a case where, you know, leaders in organizations who are like me don't know hardly much at all. And really, that's a big education gap too, I think.
I'm a registered nurse. I watched my cholesterol go up over the course of about 15 years, from a normal low 200 total cholesterol to almost 300, before I was like,
Mm,
I should probably do something about that.
Mhm.
And fortunately, now on a very low dose statin, but it's back in normal range. But I didn't know that post that menopause and postmenopause put me at risk for that
Mm,
until it was at such a point where I thought I really don't want to have a stroke. I don't want to leave
Yeah.
my kids, or my family taking care of a stroke victim.
yeah,
And I should do something about this. I should have known about that a decade ago.
yeah,
Mhm.
And I have no there I have, I'm a nurse. I should have known that.
yeah.
But I'm an oncology nurse by background, so I didn't learn menopause in nursing
Mhm.
school either. And it became such a passion of mine as I watched my cholesterol go up and finally said, I better start taking a statin. That I said, how many other women are going through this risk? And we know heart disease is the number one killer of
Mhm.
women. 1 in 5 women will die of a heart attack.
Wow.
So it really just became this kind of lifeblood for me to spread the word and get women healthier in their last 2 to 3 decades of
Mhm.
life, because that's that being vital up until your 80s and 90s is so much better
Mm,
than the alternative.
I appreciate that you share
yeah.
that personally because I think there's maybe a little bit of a fear. You think, you're a nurse. If you didn't know that that was related necessarily to menopause or postmenopause, I didn't either. Even when I figured out the whole vertigo thing or something like I'm like you that number went way up and I was like, so what I love is that instead of being reactive or having your employees be reactive or their partners or spouses be reactive, this proactive approach, it not only helps them feel the care, they get the care they need, it helps the bottom line too, because then you're not waiting until they have a heart attack that you're then covering, right? You're
Right.
really helping everyone at the front end. So it's really beneficial for both, I think, the employee as well as the company, both sides. As I would feel comfortable making that argument to my CFO or a CEO if I needed to, right? If I
Right.
just had that little bit of information. But yeah, I had like you, I had no idea that that was related to these other things at all.
Mm,
I mean, I exercise, I'm
mm,
healthy,
Yeah.
I eat fairly well, I don't eat processed food. So I was like, and it's not genetic. So I'm just kind of like, no, I don't think I have to worry about that. I don't think I have to worry about that until it was at such a point. And I think, it just, again, I was like, okay, I'm on a bandwagon here.
yeah.
Yeah. It's hard to deal with things after the fact too, right? It's harder to correct something than to prevent it. Right?
It is,
So,
and so much more expensive. It is
right.
so much better for us to get in front of it and
That's
help
right.
women understand how to stay vital
Yeah.
in their last 2 to 3
Yeah,
decades
and
of
I
life.
think just talking about these issues too is what is going to help folks like me, and even folks like in organization, but folks outside of the organization, right? You talked about marital problems or problems with
Mhm.
relationships, and some of that is just not knowing, right? And
Mhm.
folks needing to be better educated, and so that hopefully they can become more supportive and more understanding, which I think is really critical as well. But I do think like there's such a benefit to no pun intended for organizations to work with an organization like Lucy RX who's pushing and talking about these issues on the forefront. Because I'm not subscribed to Pharmacy Benefit Manager Today magazine or anything, so I don't know what the other ones are talking about. But I suspect they're not talking about this. Maybe right now they're talking about GLP-1s, or maybe they're talking about, I don't know what they're
Mhm.
talking about. But I feel like, and some of that is probably because some of the PBMs, and I'm not trying to put you on the spot, Susan, like calling out competitors, but my sense is there's like 3 or 4 massively big ones in the United States, and
Yes.
they're just giant, giant, giant companies, which is fine, right? Whatever. But I feel like we're talking about very human issues, very personal issues, very really down to the person issues, right? And I think working with a company like Lucy RX could offer organizations much better way to support their employees down to the level of the individual, right? A person can ring up or chat up one of the care guides and get a person who knows what they're talking about to help them. I think is
Mhm.
that's a great opportunity and a great solution. And this is just me just talking off the top of my head, but Susan, again, I don't want you to have to call out competitors or anything like that, but maybe just we'll kind of sort of start to wind up with that, just how you guys approach helping your members to really, to thrive, quite frankly.
Yeah. Yeah. It just doesn't exist in the space. I've been in this space for 25 years, and it has, PBMs were introduced to really be transactional, to replace the receipts in the shoe boxes
Yeah.
that our parents sent into their indemnity plans.
Mm.
And it hasn't really evolved much beyond that transactional nature. And so the reason we came to market was patients deserve more. Patients' prescriptions are much more expensive, 3 times more than any other comparable country in the world. Um, and we have the worst health to show for it. So
Yeah.
is it an affordability issue? Is it an access issue? Is it a knowledge issue? It's all of the above. And how do we fix that? But through education.
Yeah.
Through education. So we can ignore it. We can put our head in the sand. We can continue to transact claims and process claims and dispense drugs. But if we're not talking to the people at the other end of the prescription, and we treat it like a white bag at the pharmacy counter without context or without knowledge or education, then we're doing the same thing that the PBM industry has done for decades. That's our mission, is to be the next generation PBM care partner that can help employers improve the health of their employees.
Yeah.
And when you improve the health of your employees, you reduce your costs.
You sure do.
Absolutely. Yeah, that's what I mean. It's a win-win. There's no reason not to. I think, again, it's just about informing as many people as we can reach, which is why we said yes to this interview. We want to be that partner to you all to help spread the word so
Yeah.
that people can start making some really educated decisions, business decisions. It's not a benefits decision, it's a business decision on how to keep your people, keep them happy, keep them healthy, right?
Yeah.
So,
You
yeah.
invest in your employees, to hire and recruit and train. You
Yeah.
want the best from them. So I can't tell you how much I appreciate the conversation and your interest in the topic and giving us, a platform to talk more about it. It's
This was
just
super fun.
Yeah.
No, it's our pleasure. We love this. This is really, I think, where we do our best stuff too. I love, payroll technology, but, I'm not sure that's really going to change anybody's life, today, listening to another conversation about that. So, this is what we really like to do. So I want to encourage folks to go to LucyRx, LucyRx.com. That's the website. Loads of information there. Really cool website, actually. Where's the Lucy name come from, by the way? That's an interesting name.
Yeah, Lucy derives from Latin for
Oh.
light. So LUX is Latin for light, and what means we're shining a light for members on better health, and also a light for plan sponsors on better ways to build a benefit.
Awesome.
I love it. Thank you for letting us be part of the light then.
I dig it.
That's what we
Yeah.
want to do. Yeah. And please come
Really, really
back
cool.
as things
Will do.
evolve. This is something I know that is going to be changing rapidly in the next, year, 2 years, 5 years. So yeah, please do stay in touch and we'd love to have you back on as there's new things that employers and employees should consider when they're,
I
looking
would
for
love
their
to.
care.
All
I
right,
would love.
Susan. That's Susan Thomas. She's the Chief Commercial Officer at Lucy RX, a modern PBM, PBM for the modern world of work. I'll say I don't know if that's a tagline. I made that
That's
up.
great.
Feel free to use it.
We'll use it. Thank you.
We'll put it on link on the website. And thank you again, Trish. Great stuff. Thank you. I know it's been a busy couple of days here for you, but thank you for you driving the force behind these kind of conversations on the show. I really appreciate that.
I'm grateful. I learn every time we have these conversations. It just helps my well-being, Steve, so I can keep working with you.
Good. Get back to work immediately. No, I'm kidding.
Thank you.
All right. Go to hrhappyhour.net for all the show archives as well. And my name's Steve Boese. Thank you so much for listening. Subscribe to the show, YouTube, wherever you get your podcasts. And we will see you next time. And bye for now.
Thank you.